Our next presenter is Davita Perry. She is a health educator with a master's in public health and works at the Ramsey County Health Department Child and Teen Checkups program. Say that 5 times fast. This presentation is entitled Eliminating Tooth Decay in the Karen Refugee Population. The Karen Organization of Minnesota estimates that there are 6,500 Karen refugees in Minnesota, and the majority of these reside in St. Paul. In 2015, the Ramsey County Oral Health Zone conducted qualitative and quantitative research on oral health knowledge and behavior in this population. Please join me in welcoming Ms. Perry.
Thank you. Hi, guys. So, we are part of the Minnesota Oral Health Zone project run by Mary Vanderwert, and Nan Wern, who's here from Child and Teen Checkups, and Deb Bernier from Head Start kind of launched this project with a vision, and their goal. Basically, they kind of started from this place of we want to increase oral literacy in our community, concentrating on residents who are dual language learners or refugee populations. And a big reason they came about to that focus is so many of these youth are coming from parents who had no access to dental care in their childhood. That idea of just a dental checkup was just not something ever available in the environment they were coming from. And so what we really felt is if we were ever going to encourage access to dental care and routine dental checkups, we kind of just had to come from this place of education of why is oral health important? How is it connected to the body? What does oral health hygiene mean? And so they really wanted to start kind of educating, maybe more in smaller groups, community residents, just about what oral health was, why was it important, and then why that then meant that you should go get a dental checkup. And so why did we choose to focus on the Karen community since that original vision was just all dual language learners and all refugee populations? A big reason we chose to focus on the Karen, first of all, is we know that there's lots of refugees settled in Ramsey County. It's one of the main sites that refugees coming to Minnesota are settled. And then we also knew that dental care just across Ramsey County access was very low. So Child and Teen Checkups, which is a Medicaid population, we track how many kids get routine preventive care, how many kids get routine medical care. Our medical care numbers are really good. Kids getting medical checkups is almost 80%, which is our goal. Our kids getting dental routine care is much lower. It's at about a 40%. So we know that we're doing a much better job getting our kids in for medical checkups than dental checkups, and so this seemed like a really great issue for our program to focus on. And then we also know that Ramsey County has a very high proportion of refugees from Burma, both the Karen and the Karenni population. And so we felt in Ramsey County, since this was a newer refugee community, that it would be a good one to focus on. And the other thing we were really, really lucky about is we have 2 incredible Karen staff members with Ramsey County, Say A and Sakapupe. And we could never have done this project without the ties that they had to their community and the respect that they had their community. And so it was kind of one of those things of we're going to focus on this population because we have the resources to really serve this population in a different way. So what did we do? Basically, Sakapu and Sese did an incredible job setting up tons of meetings with Karen community leaders. And so we really started from that place. And what was amazing about these meetings is they were kind of like, I call them meeting/in-depth interviews, because the goal of them, we had a long list of things that we were trying to get out of these meetings. Starting with, we were trying to gauge, was the community invested in oral health? Is this something that community leaders thought was important? If they didn't think it was important, we were supposed to educate them on why it was important and try to get them on board. And then we were supposed to take it even into this programming step of like, okay, that's great. Now either you decided that oral health is important, how do we target your community best with oral health education? And what was really cool about this is we were able to do a different form of programming than with each person we met. So in terms of meeting with church leaders, one said, come to our Sunday school. Another said, maybe it'd be better for you to come to our vacation Bible school in the summer. Another might say, we want you to come to our youth groups. And so each community person that we met with, First of all, we got kind of their feelings on oral health, which was this sense that, yes, this is very important. We were able to kind of say our piece of like, this is the population that we want to reach. We want to reach kids. We want to reach parents. We want to reach teens. And then they were able to say, great, this is how you can go about doing this. And we did a basically completely different type of programming scheme with almost every person that we met with. Corinne Organization in Minnesota, we started meeting with their teen clubs in the high schools. Church leaders, we done a ton of Sunday school presentations. So that was really, really helpful to be able to kind of meet every community partner where they were at and meet their needs as well as our needs. We also felt that we wanted to do a little bit of research just to better understand Corinne oral health knowledge and behavior. And we kind of came up as a team on our oral health zone, kind of the health topics we were most interested in. And I'll talk a little bit about that more. And then finally, we did this whole wonderful community gathering, kind of a lunch where we got everybody we were working with together and did kind of a brainstorming session amongst everyone. And it was a great way to just really hit that message home that yes, this is an important issue for the community. Yes, the community cares about this issue. And then good information for us on what topics we needed to be covering and what people felt were important issues. So people who were present was Mary from the Minnesota Oral Health Zone, Child and Teen Checkups, several dental clinics, community dental and children's dental services were there, and then lots of Corinne, both secular and religious organizations were there, along with certain government agencies. So WIC had a presence, FNIP, which is the University of Minnesota Extension Home Visiting, kind of more peer education program. They were present. So it was a really great mix. So what did we decide to include in our dental health survey? So this is kind of when we were going directly to the Karen population and understanding a little bit better what issues were going on. So things that we decided to focus on is just asking questions about toothbrushing. We wanted to ask about access to dental care when people had had a dental checkup. We were a little bit interested in their water choice. Were people drinking tap water or bottled water in the home? And then we also wanted to look into snacking, kind of what snacks were people eating, what was the frequency that people were eating these snacks. And then as we did the survey, something that kind of started bubbling up that was just kind of people were self-reporting was whether they were a new arrival to Minnesota, whether they'd just come to Minnesota, or whether they were a refugee that had lived in Minnesota a couple years. So how we broke that down is basically if you'd been in Minnesota less than 1 year, we counted you as a new arrival, or if you'd been in Minnesota for greater than a year, we kind of said you were a longer term resident, and we found pretty big differences between these two clusters. So how did we go about doing this? It's, as a person with a public health, very sciencey background, this was not the most rigid study. It was a convenient sample. Child and teen checkups, we call every family that's new to Medicaid anyways, and we ask them if they have a doctor, ask them if they have a dentist, and try to get them set up with regular checkups in both those areas. And so we thought, well, we'll just tack on a few questions before we get to that part of our spiel for our staff doing those Corinne phone calls. So all the phone calls were done by our Child and Teen Checkups Corinne staff. They were all done in their native language. And so we just kind of had like 5 or 6 questions that would predate. And then after people answer those questions, we'd say like, great, this is our regular child and teen checkup spiel. Can we get you set up with a doctor and a dentist? And they'd provide some oral health knowledge also. And so who were we calling? It's Child and Teen Checkup serves everyone age 0 to 21 on Medicaid, and we were doing this as part of our new introductory calls to new enrollees. So this means either you're brand new to the program, or it means that your certification has lapsed and you're rejoining, which could be for any number of reasons. Could be a change in income, or it could be that you just didn't get your paperwork in time, and so now you're back on the program. And that was the reason that we had so many people we were interviewing that were brand new refugees, is because they were just completely brand new to the program in Minnesota. And then so we were able to sample a total of 40 individuals, and almost half of those, 17, were new arrivals to Minnesota. So what did we find out? So the really cool thing we found out was that 75% of families are brushing at least twice a day. So that's great. And that was really, really helpful for us to know that toothbrushing is just a really widespread practice amongst the Korean community. I would say probably like most people across our entire community, toothbrushing for 2 minutes may not be as widespread, but people are brushing twice a day. So we were like, great, this is something that's already a practice. We also looked at dental clinic visits, and that's where I'm going to kind of break this down to what was going on for longer-term residents and what was going on for new arrivals to Minnesota. The majority of new arrivals had yet to see a dentist. Many of them had just come to Minnesota, maybe been here 2 to 3 months, and I think we're just kind of getting their medical care visits. But a lot of them did report just kind of qualitatively that they had a dental visit scheduled or that they'd heard about dental care. Like they knew this was something that they were supposed to do. And so you can see that number is 88% of people had not gotten in to see the dentist at the point that we talked to them. So something to note is that with our new refugees, we are not getting them in to see the dentist right away. This is something that is taking at least longer than 6 months probably to get people set up with their dental visits. With longer-term Minnesota residents, people who've been in Minnesota over a year, the good news is that only one family reported never having been to a dentist. So we are seeing is that within a year, we do tend to get our new refugees in for a dental checkup. That doesn't mean they're in for routine dental checkups. That just means they've had at least one dental checkup. And so what we kind of asked at the question was, have you had a dental checkup in the last 6 months? And a significant number of families had, and that was about 42%. The other half basically had either couldn't remember when they last went to the dentist, which kind of we thought probably meant it was longer than 6 months ago, or, kind of mentioned that it was like at least over a year. And so we really felt that what that meant was that we needed to do a better job getting people in, youth in regularly. And because new arrivals weren't seeing dentists right away and longer term refugees weren't getting in regularly, they probably weren't getting much oral health education. Or if they were, it was gonna have to come from public health, from primary care, from a different source that they had more contact with. We also asked about children's snacking, and we just were like, we'll just ask about a couple different snacks and see what it seems people are eating. Juice, of course, I think is gonna be the highest one, candy. But the really thing we took away from this is, as you can see, every orange bar is higher than every blue bar. And what that means is the longer you're in Minnesota, the more junk food you're giving to your kids. And this is probably for lots of different reasons. I think just resources, families having money to buy these foods for their kids, families having a desire for their kids to adapt to the American diet, and also just this notion that the American diet for some reason is healthy. The American diet is not healthy. It's not good for you. It is not good for our children. This shouldn't be something that we are encouraging. And so that was something we really, really took home, that families, the longer they're in Minnesota, they're adapting this practice that is not good for their kids' teeth and not good for their kids' bodies. And they probably have no idea. They're just so excited to be able to provide something for their kids to be American, for their kids to be getting these things that American kids are getting. And so that was something we really wanted to address when we did education in the community. Another thing we got was about tap water versus bottled water. And if you look at our graph here, it should look hopeful, because it's like, oh my gosh, 62% of families are drinking tap water, 26% are drinking both tap and bottled. So it means they're probably mostly drinking tap water, maybe bottled when they're, and we asked in the home, which do you drink? So this should say that it's really good news that families are mostly drinking tap water. What we found qualitatively when we asked this question is families were like, yeah, of course we're drinking tap water. That's all we can afford. We'd love to be drinking bottled water. You know this already. And we found that also out in the community, that people were like, bottled water is safe, bottled water is clean, bottled water tastes good, it's the symbol of development. Tap water, I think a lot of it, people just thought it smelled bad, they thought it tasted bad, they thought it looked bad, that it was contaminated by lead pipes. There was this sense of like, we drink tap water because we have to, because we can't afford anything better, but it is the lowest choice that we can do. And so what that kind of suggested to us is that as people had more resources, and we really did see that families that had been in Minnesota longer were drinking more bottled water, and that we decided was most likely a resources issue. They had the money to buy bottled water, and so they were choosing that. And so we really felt like, shoot, this is probably not going to stay this way. Families are going to be moving away from bottled water as they can. And when we checked with our other staff members from other refugee populations, this was a pretty widespread belief that tap water is dirty and unsafe, bottled water is clean and safe. And so we really wanted to address this. And I think we're still trying to figure out exactly why that is, that tap water is considered so unsafe, but that was something we really wanted to address. So what did we take away from this? A big thing was just that medical clinics and public health programs are key sources of oral health information and education. Unfortunately, we just are not getting people into the dentist regularly enough and soon enough, especially new refugees, for that the dentist even to get the oral health education to them. And so that oral health information has to come from lots of different sources. We also really wanted to make sure we educated people about healthy snacking, sugar, acid, how those affect teeth, and also about the safety and benefits of tap water, and that, brushing seems to be pretty standard, but since people are doing it, why not have them brush well and really hone in on the 2 minutes a day, 2 minutes 2 times a day thing. So what did we create from this? We created this Prezi presentation. Do you guys know Prezi at all? I pulled it up so at the end we can show you guys a little bit. It's pretty fun, kind of moves around the screen, and we tried to make it really kid-friendly, really family-friendly. We used a ton of animal videos, and while the Prezi itself was in English, because you can't get the Karen script in there, it was always given when we were presenting to the Karen community, or if we're presenting to a different refugee community, it's always given in that language that were of the community that we're presented to, and the words are pretty sparse. It's mostly, like a hippo getting its mouth cleaned by fish, and that's how we talk about the dentist. So it's very visual, and it's easy to kind of fit in the words of the language. So what do we talk about in this presentation? We do talk about bacteria transmission, really encouraging people to keep their teeth clean, that notion that you're passing bacteria from mouth to mouth through feeding, sharing spoons, cleaning pacifiers, that type of thing. We really talk about routine dental care, brushing teeth for 2 minutes. We do mention flossing, and then we do a lot with healthy snacking, both the idea that we want to eat healthy foods that are low in sugar and that we don't want to snack on foods all throughout the day. So the difference between how quantity and frequency kind of affect our mouth differently. So we talk about that with healthy snacking, and then we address the tap water issue. And I just put in a screenshot of that slide, and we usually for this one will have people raise their hands of how many people think the tap water and the water bottle is better for teeth, and how many people think the bottled water is better for teeth. And we always get that the bottled water is better for teeth. So definitely an issue we have to keep working on. And then we kind of usually would break kids or families into groups and do some activities. So I have here, we have like a big mouth and they have to brush the teeth for 2 minutes, kind of hone that in. We have a little coloring activity that has some nutrition stuff, a little puzzle that they can draw, and then we used the National Children's Oral Health Foundation kit to again talk about snacking and how that affects our teeth. And that was just kind of to like do a little bit more interactive component to our presentation. So where did we go for this presentation? We went all over the place. Churches were a great partner. KOM was an amazing partner. Vietnamese Social Services hosted one event, but it was attended by 100 people, so they were pretty incredible getting that many people to the site. We worked with the FNIP program, kind of doing peer home visiting with them to kind of meet with small groups and do dental health education with them. We went to Corinne Home Child Cares, and the message was a little bit different with the child care programs. A lot was kind of helping teach child care providers how to brush kids' teeth, kind of encourage them to be brushing kids' teeth in the home, keeping toothbrushes for the kids there. St. Paul Parks and Rec was a great program. They have lots and lots of after-school programming, so we went to a lot of those sites, some of their preschools and some of the other preschool programs. So in total, so far, kind of starting in January more or less of 2015, we've done 42 presentations. We've reached 599. Corinne, I would say we've probably reached more. I just kind of pulled the data for presentations specifically to Corinne partners. Obviously at St. Paul Parks and Rec, in school and community preschools, we're reaching other Corinne kids. But that's not specifically where we're targeting the Corinne population. And we've reached over 1,000 people total with this presentation. So that made us feel really good about kind of our ability to blanket the community with oral health education messages. And that was kind of the vision of the oral health zone initially, was just let's try to blanket the community as much as we can with these messages. So that's a little bit about kind of how we set up these presentations, how we designed the presentation, and then what we've done so far. And so now we're working on okay, what next? And we mostly just decided everybody can hear about taking care of their teeth once a year, and that's fine. And so we have no hesitancy in just repeating these presentations, going to the same place, maybe even doing the same exact thing because the kids change, different kids are there, and we could just try to make it an annual thing where everybody learns about taking care of their teeth. We also just really wanted to expand more with our current partners. So the rec centers, maybe we'd done 5 after-school programs. Why not hit all of them? The same with the churches, there's a new church in the Corinne community. Same with the high schools. We kind of started with them towards the end of the year, so try to reach more. So just really ramp up what we were already doing, and still really try to focus on reaching Corinne parents. We found it a lot easier to get in touch with kids than to reach the parents themselves. So really try to get into places where we can work with parents directly. And then we've also kind of started brainstorming about ways to encourage Corinne youth, primarily teenagers and young adults, to advocate for better access to dental care in their communities and kind of encourage potentially people interested in pursuing oral health careers. So what can we do to help that happen? Another idea we have is just to expand to other refugee communities. We've got this presentation set. Child and Teen Checkups staff speaks lots of different languages. Why not go to Somali child care programs, after-school programs? And that's something we're just starting to do, and hopefully we'll be able to do more of. And then this is an issue because I came to Child and Teen Checkups from WIC, so another focus we're trying to really get on is really encouraging oral health care during pregnancy, and really encouraging pregnant women to get that checkup. One of the things we've kind of come across is a lot of women in our community only have dental care while they're pregnant. Maybe they're undocumented or typically uninsured, or they just have no idea that they get dental care with their medical care that they're getting while they're pregnant. And so that's the main message we're really trying to hit home is you have dental care during this window of time, please use it, get a checkup, focusing on that kind of bacterial transmission with them, and then also focusing on kind of baby oral care, wiping down the gums, that type of thing. And we've been partnering with WIC to do that. We've gone to some of the prenatal clinics, Mothers First, which is our Ramsey County program that serves mothers who've been involved in substance abuse. And so just really trying to partner specifically on oral health during pregnancy. Mary's kind of working with us. She's got a survey to kind of work to measure the effectiveness of the oral health kit that we've been using. And then ultimately our goal would be to track our impact to see as we calculate how many people on the Child and Teen Checkups program are getting a dental checkup, is that increasing? And obviously all of us as a community are working towards that, and so lots of people's impact will be in that, but that's kind of our overall goal. All right, do you guys have any questions or comments? I can also pull up the presentation that we did for you. If you want to see it. This is our 4 kids. Oh no, it's not even there. Okay. Or I might not be able to. Ah, here it is. So we kind of start, do you guys want to watch this? Okay. I'll just pretend you're like my typical 8-year-old audience of 8-year-olds. So we start with this little, oh, I don't know if you'll be able to hear it because I don't have it plugged into sound. Oh, that's a good idea. I don't even know where the...
Monique, it's some Decay on 15. Have you been flossing, Mr. Harold? Receding gum on 24. Look, Monique, leftovers on 32.
Oh. And that was it? Okay. So with that video, we kind of talk like, oh my goodness, wouldn't the birds be so scared to be in the crocodile's mouth? But this happens in the wild. And if even the crocodile is willing to let birds come in and clean his teeth, and the crocodile sees that's important, maybe that's something, we should see as important too. So then we ask kids, why should they take care of their teeth? And we do get cavities a lot of times and things like that. They kind of can sometimes get that you need your teeth to eat to talk. So the things we talk about is cavities, fresh breath, prevent infection, and we talk about how that infection can even move into our hearts and cause heart disease. Tooth pain, and we kind of talk about how that might make it hard to pay attention in school, or you might feel grumpy and kind of, mad at your friends and how that affects our behavior. And then how it can be expensive. So our routine checkups, we always say aren't expensive, but sometimes if we need a lot of work done, it can cost our families. And that's because we think we're presenting to Medicaid populations based on the demographics, but we don't know. It could be, especially at the rec centers or other sites, we're probably getting people lots of different insurances. And that it's nice, feels good to have a nice smile, and that we use it for eating. And then we talk about kind of the combination of bacteria and sugar to get to cavities, and how if we didn't have bacteria, we wouldn't have cavities, and if we didn't have sugar, we wouldn't really have cavities, and how we need both of those things. And so we break that down, and we let them know that you're born with no bacteria in your mouth, and so where does it come from? And we always get that this comes from candy, that the bacteria in your mouth comes from candy. And so we say, well, not exactly. That typically it comes, from kissing maybe. And most kids know that they have a little baby or something like that in the home. And so they can kind of understand how, we show love to our little brothers and sisters, and we might kiss them or kiss them on the mouth. And that means that the saliva in our mouth gets into their mouth. Or they might put their hands in our mouth and then put their hands in their mouth, and they're moving those germs from mouth to mouth. We talk about sharing food, and if you're maybe using the same spoon, and I typically go about this with like a story I have of a friend who would buy an ice cream cone, and she and her dog would share the ice cream cone, and she'd lick one and the dog would lick one. And so kind of explaining how when we eat, sometimes if we're sharing spoon or if we're sharing food, that means the germs in our mouth are getting into the germs of the other person's mouth. And that this also happens from helping stay clean. And our best example of this would be families that maybe clean a pacifier often in a parent's mouth rather than underwater, and why that's going to move the germs in our mouth to the germs in a kid's mouth. And we could use this as really good motivation also when we're presenting to parents for why they need to keep their mouths clean. Because people are doing all these things, and it's to show their kids that they love them, and they're not bad things to do. They're ways of caring for our kids. But if our mouth and the people who are surrounding our kids have a lot of decay, a lot of gum disease, we're obviously passing much worse bacteria into our kids' mouths. So it's a good way to really get families and parents and grandparents involved in their own oral care, I think, these messages. So then we ask kids, how do we protect our teeth? And we visit the dentist. And this is like it's a long video, so I just cut it halfway because that's when they talk about the teeth. We got it? What? I think I do. This really not much happens, so we usually talk through it anyways, and it's basically we just like say like, oh my gosh, look at the hippo. Do you think the fish would be scared in the hippo's mouth? And then the nice thing about this video is they really show the fish really clean the hippo's teeth, and we use it a lot of times to talk about like where should we brush our mouth. So they like are like, oh, look at the fish getting on the hippo's tongue, like we have to remember to brush our tongues too. And so we kind of talk all about that and why it's so important to go to the dentist to get everything cleaned off our teeth. And that even hippos know that that's something that they should do. And then at the end here, we always say, like, what does your dentist say when you go there? And, the dentist says open wide. And we're like, oh, and look at what the hippo's going to do. Like, he would make his dentist so happy. So we talk about that. So then we talk about snacking healthy, and we ask the kids what they see up there. And then we talk about what ingredient is not present in all these foods, and that's sugar. And so that if we kind of go back to that, how sugar and bacteria cause cavities, and so if we were eating these foods during the day, we wouldn't be as likely to have cavities. Then we have our links player. We have a funny scenario where we say, okay, these are not healthy snacks. Your doctor would never like these snacks, but they are snacks that our population, I would say, eats a lot of. And so we say, okay, so this is Maya Moore. She's got her favorite snacks, Gatorade and Cheetos. We've got two different scenarios. One, she's like practicing all day. She's super hungry. She comes home and she just pounds the Gatorade, eats the whole bag in one setting. Or, she's practicing and then every break she takes a couple sips of the Gatorade, a couple bites of the Cheetos, and she does that all throughout the day. And we ask the kids which is better for her teeth, to eat it all at one time or a little bit throughout the day. And ultimately, we kind of use that to explain that every time we're putting something in our mouth, our teeth are decaying for 20 minutes. And so having just our 3 meals, 2 snacks is going to be a lot better for our teeth than continually snacking on something all throughout the day. And we go into, when we do our teen presentation, we go into this a little bit more and talk more about like soda and kind of high acidic candy, but for our kids, we usually just kind of keep that message pretty simple. And this is mostly what we've been doing for the Karen community. And then we ask, the slide I showed you, should you drink tap or bottled water? And we talk about drinking tap water. And then brushing our teeth 2 times a day for 2 minutes. And with this, we're just really encouraging people to use some method of timing themselves, because that's a really long time, 2 minutes. And we try to hit that home too by then with the activity, having the kids brush the mouth for 2 minutes. So they really get a sense of like, this is most of them are very excited to brush it, and then by 2 minutes are really bored of brushing it. And so they do get kind of the sense of that. And then remember to floss. And this one's kind of gross, guys. I'll just warn you ahead of time. So we, even though that we didn't ask about that, we do mention flossing in our presentation. So I think with this one, we get a lot of kids being like, ha ha ha, she's flossing with her butt hair. And I'm sure we're like scandalizing all the parents because their kids go home and talk about flossing with your butt hair. But I think it does create like a really sticky message. And we can be like, aren't we lucky? We don't need to floss with butt hair. We can use actual floss. And who knows if this is making kids floss, but they're thinking about it. And then this is just the general child and teen checkups messaging that we want everybody to see their doctor one time a year and their dentist twice a year, and that our program helps with that. And then we just will usually ask the kids to kind of then tell us back what they're planning to do to protect their teeth and body moving forward. So yeah, that's kind of the presentation we've been doing. The teen one is a little bit more elaborate. It's got a little bit more going on, as does when we talk with oral health during pregnancy. We make it more specific to that population. And then our preschool one is a little bit more stripped down, but the ideas are pretty general. So that's kind of our process and what we've created. And I think that the dental health education, what we've really, not only have we been able to reach a lot of people, but it's opened doors for us in the community. It's information people really want. It feels very non-threatening. It's pretty cute. And so I would say that as a public health organization, it's a really great topic. I found it to be a really great topic to do, just to even start establishing partnerships and get in places that we weren't in before. So that's been really cool. Any questions for us and comments? Yeah.
Students.
Mm-hmm.
And so I was just wondering, like, how did you isolate those students? Or
Yeah, so we were really lucky. So KOM, which is the Karen organization in Minnesota, they have teen clubs, and they operate those. Some of them were in the summer at the KOM office, but then they also have kind of Karen clubs, which are just like cultural clubs for students at the local high schools, St. Paul Public Schools. I don't think they're in every St. Paul Public School, but they're in several of them, and they're huge. It's for both the middle school and the high schools. So we partnered with them, and we just came in and presented to their students, and then we've gone a couple other like already existing teen clubs in the community, and then the Karen youth groups. One other place we can go is a lot of churches operate youth groups in the evenings. And so we haven't done this presentation with those youth groups. We've done some of our other presentations, but that's another place that we think we could expand and go to.
okay, thank you.
So I researched betel nut when we first started, and that was definitely an issue that came up out of our community interviews. I think the main thing that came out of it is that it's not something affecting our population age 0 to 21, because most of those people that we're seeing are youth or teens who are enough assimilated that maybe they do a little bit of betel nut, but they're not doing it a whole much, and they really want to have white teeth as this kind of more American ideal. And so doing enough betel nut where it's going to stain or cake their teeth wasn't something that we're seeing as a dental health issue among that under 21 population. I do think it is a dental health issue probably for more, middle-aged and elderly population in the Karen community, and we definitely did hear that during our in-depth interviews with the community. But when I did some research, and I just went and I read health articles that were coming out of like Thailand and these countries, very definitely clear link to oral cancer. Very clear link to oral cancer, and we do mention betel nut we have a smoking and alcohol and tobacco presentation, and we bring that up, that this does cause cancer the same way all these other tobaccos cause. But in terms of like how it caused cavities, there's actually some interesting research that like, in essence, because it like coats your tooth, and it like, how you've got your dental, I don't know these words, but the dental ridges on your molars, that it goes up and down. So betel nut, because you're chewing on a rock, like flattens them in essence. And they're like, well, maybe it actually like prevents cavities because it's like you don't have the dental ridges for the cavities to get into, and it's completely covering your tooth. So, and the tricky thing is all that research is coming out of populations that don't have access to dental care. And so you're saying, you know, and so it wasn't really replicable over here where you could see a dentist every year as an adult. So it just wasn't something we ended up focusing on. And I think it's going to be a tricky issue to address in a maybe a different setting, because so much of the research on that is not coming out of a setting like America where you have that access to dental care.